Today we're going to talk about HPV. We will learn about HPV, which is short for the human papillomavirus, and cancer. We will learn about how HPV causes cancer, screening and testing for cervical cancer, and how we can protect ourselves from getting HPV by getting the HPV vaccine. What is HPV? So HPV, human papillomavirus virus, is a virus, right? And there are about 150 different types of this one virus. Some are harmful and some are less harmful. So some of the types can lead to genital warts. Others can cause cancers in the penis, cervix, vagina, and vulva. And others can cause mouth, throat, and anal cancers. So important to know before we talk about cancer, what cancer is, right? So cancer begins in healthy cells when some of their machinery inside, their DNA, their genes become damaged or mutated. So the damage to the cell makes the cell stop acting the way it normally does, and it starts behaving in a way that's not normal for that particular cell. Sometimes this mutation or change in the cell can make the cell start to reproduce out of control. It just splits in 2 and splits in 4 and splits in 6, and that's how cells reproduce. So what happens when you have this cluster of damaged cells that aren't functioning the way they should be functioning? That's what happens when a tumor forms. A tumor is basically a cluster of cells that are damaged but are reproducing and not operating the way they normally should. Unfortunately, tumors can split up. Little pieces can come off and travel through your lymphatic system, which is a way for it to travel in your body, through your lymph nodes, and end up in other parts of your body. And that is how cancer can spread. Okay, these are HPV-related cancers, right? So again, it's a virus that can mutate your cells to cause cancer, and it can cause cancer in a lot of different places. It can get it in your mouth, throat, for men in the penis or anus, for women anus. Women most often get it on the cervix. Men most often will get it in their mouth or throat. But it's not just the cervix, it's the vagina and it's the vulva as well. And what types of cancer does HPV cause? It can cause nearly 100% of the cervical cancers out there, 9 out of 10 of anal cancers, 3 out of 4 of vaginal, about 7 out of 10 or 70% of vulvar, 7 out of 10 in mouth and throat, and 3 out of 5 penile cancers are caused by HPV. How do you get it? Well, it's a sexually transmitted disease. Anybody who's sexually active can get it. It can be transmitted through childbirth and also through skin-to-skin contact. The virus is transferred through tiny invisible breaks in the skin during unprotected sex. You can carry HPV and not know it because you may not have symptoms. Most of the time, people don't get symptoms initially and don't get them for quite a while, or sometimes don't get them ever at all. If you do get symptoms, it could be years after you have sex with someone who's infected. Keeping in mind that condoms offer some but not total protection because they only cover a certain part of the skin. It doesn't cover all of the genital skin. And interesting to know, about 80% of adults who are sexually active have had it at some time in their lives. Most people do clear it, and most people never know they had it. Now, how does HPV cause cancer? Like I said a second ago, usually HPV leaves the body naturally. You never know you had it, but sometimes the HPV doesn't leave and it stays in your body. In women, it can live on the cervix or in the throat, and men in the throat or in the mouth. The longer somebody has the infection and doesn't clear it, the more likely it is for abnormal cells to develop. And if left untreated over many years, these cells can develop into cancer. And now we'll talk about cervical cancer. So what is the cervix? It's a cylinder-shaped opening that connects the vagina and the uterus. This is what the doctor sees during a pap smear. They see the tip of it. But these are the cells that are most damaged by HPV. There are some risk factors for cervical cancer, the biggest being HPV infection, but it doesn't help also. You're at risk if you have a weakened immune system, if it runs in your family, if you have a poor diet, you don't have a lot of fruits and vegetables in your diet. If you also have a chlamydia infection, you're at bigger risk for a cervical cancer from HPV. If you've had early pregnancy, more than 6 sexual partners in your life, or early sexual activity. So these are all risk factors for cervical cancer. But when a woman specifically has HPV, there are additional things that increase the cervical cancer risk. 7 or more full-term pregnancies is a risk they have found. Smoking cigarettes, surprisingly, a lot of people don't know this, but smoking cigarettes just on a regular day and will affect your cervical cells. But if you have HPV, these other risk factors, and you smoke, you're at bigger risk for having that HPV turn the cells abnormally. I mean, also the other risk is long-term use of the birth control pill. So what decreases your risk? You can get vaccinated against it if you're under age 45. It's not recommended for people over age 45 because it's been found to be much less effective. And then also using condoms to a degree. And there are 2 tests that look for high-risk types of HPV that can cause cervical cancer, and it's the Pap test. And during the Pap, your Pap smear, you get the HPV DNA test. And what that is, it's just another swab during the Pap smear where DNA from the HPV virus is looked for in the cells. Okay, so this is just kind of a cross-section photo of a Pap smear, and it's done as a part of a routine pelvic exam. And what it does normally is just you take a swab of the cells of the cervix and you look for anything in the laboratory. These cervical cells I look for any abnormal precancerous cells, viruses, or anything else. Okay, so the HPV DNA test is looking under a microscope to determine damage or mutation from HPV. It's done at the same time as the Pap, and it might be even with the same swab. It just kind of depends on the doctor. So things you can do to reduce your cervical cancer risk, and this is just a timeline of your life, right? What can you do throughout your life? Anyone under age 45, starting at age 9, can get the vaccine. The vaccine will protect against the more dangerous, because I told you there's 150 versions of HPV, and there are a good 9 or 10. Those are the ones that really can cause cancer, and those are the ones that you are protected against through the virus. Throughout your life, you can always eat as healthy as you can, including lots of fruits and vegetables. You can choose not to smoke and make sure that you use condoms. And then in terms of screening guidelines, these are federal guidelines, right? So just people who are at average risk, and we just talked about the risk factors, should be screened for cervical cancer with a Pap smear every 3 years between age 20 and 30. Between age 30 to 65, you can get the Pap and the HPV test every 5 years. You can go sooner than that. I recommend that personally, but the federal recommendations say, when you're younger, every 3, and when you're a little bit older, every 5. And then if you're older and you've had regular screenings and everything's fine, you could stop screening with permission from your doctor, unless you've had serious illness or cancers within those last 2 decades. And this is also really important for everyone to know. So there are no federally approved tests to find HPV-caused cell changes or infections for any other part of the body except the cervix. So you can check these cell changes in the cervix, but it has not been developed to check it rectally or in the vulva, vagina, penis, mouth, or throat. There are certain populations that could be at higher risk for HPV, such as anyone who has anal sex or anyone who is HIV positive. They do have anal Pap tests that can help you to detect early cell changes that are precancerous. And there's no screening for the other cancers caused by HPV. So if you are of age and you can get vaccinated, if you have children, grandchildren, siblings that have not been vaccinated, please urge them to do so. Okay, so talking about the vaccine, it works best when it's given at young ages, between 9 and 12, and that's well before any child gets exposed to HPV. And some people do experience mild side effects, but it's the same as with any shot. Like you get pain or redness at the injection site, it'll go away within a day or 2. And it has been around for a while, and it has been found to be safe and effective in preventing virus and in preventing cancer. How does it work? When the vaccine is given, our bodies respond by making antibodies. And so if the person is exposed to this HPV virus, the person will be protected by the vaccine. The antibodies will clear the virus from the body. Again, not HPV totally, just the ones that are the most dangerous that can cause cancer. These are the vaccination guidelines. If you're younger, a child, you get a first shot, and after 6 to 12 months, you get a second shot. If you're over age 15, you get your first shot, you wait 1 to 2 months, you get the second one, you wait 6 months, and then you get the third. Okay. And, talk to your doctor about where to get it. there are a bunch of different places. This is just some information, but I would say first line, just go to your primary and say, I'm interested in this, or I want this for my kids or myself. And this is my group. We are a large group at the Columbia Cancer Center of doctors, epidemiologists, professors, cancer researchers, and more. And what we do is that we monitor the cancer burden all over New York City, and we're looking into communities where cancer incidence, which is levels of certain types of cancers, are higher. And we we do our best to work with community-based organizations to be able to do education for the community.